Hi, Renee.
Hey there, how are you?
Good. How are you doing?
Good. Just waiting for other AHP people. Can you hear me?
Yeah.
Just got a recording alert telling me I'm muted and to unmute myself.
I got the recording in progress alert when I logged in,
Okay, very weird.
but I can hear you just fine.
Here's Kevin.
Hi, Kevin.
Hello.
Okay. All right, I'm gonna just let folks in and assume that Christy will be able to will join and take over for me.
Sounds good.
Okay. Since I'm going to be presenting, Kevin, could you mind if I make you the co-host? You can let people in once I start to talk.
Of course. Perfect. Thank you.
Thank you. Okay. Okay. Hi, everyone. Welcome to our large group provider engagement report training. We're so glad you were able to join us today. Just waiting for a few more folks from our AHP team to join us. I will get started shortly. We're going to start with just talking about the PCP reward plan because that really is the basis for the provider engagement report, and the two really go hand in hand. So just want to provide some context for what it is that my colleague Christy Howd will be showing you on the provider engagement report. Want to give you that context in the form of just going through what the PCP reward plan is. So I'm going to share my screen, and please bear with me that I'm not going to use presentation view, only because with the number of monitors I have, it gets a little wacky. So hopefully everyone can just see my screen and see PCP reward plan up on their screen. Look good, Elizabeth and Kevin, you can see it. All right, thanks for the thumbs up, Kevin. So the PCP reward plan is effective for the 2022 performance year. And the reason that we changed the incentive plan was to just try and better align the incentives and the behaviors, the things that we were rewarding providers on. We wanted to better align with how the network as a whole earns gain sharing. And as you know, we earn gain sharing under a given contract when we do two things. We beat the budget. So we perform under what was expected to cost to care for that population in a year, and we hit our quality measures. So if we hit our quality measures, if we do amazing on quality, but we don't beat the budget, there's no gain sharing. So that was the piece that was missing from the way we incentivize providers, was incentivizing them for cost performance. So the new 2022 reward plan has components that include factors, if you will, of cost performance. So that was our desire to change it for 2022 to achieve that alignment, that you were being incentivized for the things you were doing, and they lined up with how we earn gain sharing as an aggregate network. And the plan is under this new reward plan that we are going to, we have someone in the waiting room, Kevin. We're going to pay out the reward plan in the September of the year following the performance year. So right now we're talking about the 2022 PCP reward plan, and this will be paid out in about September of 2023. Now, if anyone was on our AHP update call on Wednesday of last week, you heard the news that we have decided to hold our providers harmless for 2022. And this was in light of a number of factors, not the least of which was our delay in rolling out the provider engagement report that you're here to train on. And the reason is that you really haven't had any visibility into those elements of the reward plan that are new, those cost performance pieces and the citizenship piece. So what we have decided for 2022 is that whatever funds that we do earn that would be distributed in the form of incentives under the PCP reward plan, we're going to hold our providers harmless and just treat everyone equally and distribute 2022 incentives on an equal basis in recognition that you have not had neither the time nor the opportunity to see your performance and adjust it and drive your incentive payments. That ability hasn't been there for you, but we anticipate that it will be for 2023, which is why everything you're going to hear now about the reward plan and the engagement report still matters. It's going to be 2023 in 2.5 months. The PERV that we're going to train you on is going to be the way that you'll see how you're performing in various aspects of the reward plan. And it's absolutely our intention that everything that we have, the ways in which we changed the 2022 reward plan, the components that are included in it, the quality measures, the cost savings, which I'll give you a little more review, that as best as possible, we will align those for 23. So we're not just, we're going to train you on this and 2 months from now, dismantle it all, have a brand new reward plan with a million different factors and the different thresholds and all of those things. Our hope is that as much as possible to keep it aligned, but there'll be more communication about that in the future. So with that, I'll get started on the elements of the plan, of the reward plan that you're going to see that Christy's going to demo for you. And I want to show you family medicine first. So these are providers who see both children and adults. And for 2022, if we weren't holding you harmless, the plan would be that 60% of the incentive would be driven by your performance to quality. Within that 60%, the 50% would be quality measures and 10% would be the depression screening and follow-up initiative. And then under cost savings initiatives, providers in family medicine would be able to earn incentive in 2 spaces. LARC, long-acting reversible contraception, and to satisfy that, they need only attend a reproductive health training session, and we have those scheduled, by the way. We can talk about those a little later. And pharmacy would have some components as well, some cost savings initiatives. In pharmacy, that would be based on these medication initiatives for 22, insulin, Lispro, long-acting insulin, metformin, ER, and NSAIDs. So providers in the family medicine space and would have the ability to earn their incentive in those components. And then citizenship would be worth 10% of the total incentive. And citizenship is awarded in a number of different ways, and we'll talk about that in a second. Internal medicine, because these are the providers who don't see children, you're going to see the numbers, I'll move around a little bit, and we've put more of the reward into the quality program piece. So 75% of the incentive would be driven through performance to quality measures. 75% would be in the quality program, 65% attributed to quality measure performance, and 10% to depression screening and follow-up, while the only cost-saving initiative where internal medicine providers would have opportunity would be in that pharmacy space, and that would be 15% of the incentive, and citizenship would be 10%. And then pediatrics, similarly, only one cost savings initiative opportunity, and that's within LARC. Just like internal medicine, for pediatrics, the quality program will be worth 75% of the incentive, the cost saving initiative 15%, which would solely be LARC, and citizenship would be 10%. The citizenship component would be satisfied if on the practice level, if the practice had ticked 2 boxes, including participating in a quality improvement pilot, or that your practice manager attended practice manager meetings, activities like that satisfy the citizenship component for every provider in the practice. If the practice isn't satisfying citizenship at that practice level, then we will turn our attention to how the individual providers within the practice are doing. And they, as individuals, would satisfy the citizenship component if they do things like attend clinical grand rounds or accept emails from us, or trying to think of another one. I think maybe Vatica is one that's on the provider level component as well. But what those various aspects are, well, we can talk about in just a few minutes, and I believe that we do cover that in Christy's portion. So with that, I'm going to stop presenting and just summarize that that's the PCP reward plan for 2022. Our intention for 2022 is to hold you harmless because you have not had a real opportunity in this performance year to do the things necessary to improve performance and the quality measures. You haven't had visibility into the data. You haven't had the visibility into those four components within the pharmacy space under cost savings initiatives. You haven't been able to access the provider engagement report to know if you were satisfying those citizenship measures. So held harmless in 22. 2023 performance year starts in a couple of months. It's certainly our hope that what I've just gone over with you for 2022, we're going to do as close as possible, those same components for 23. And the provider engagement report, obtaining access and learning how to use it, it's still relevant now because it'll definitely be relevant for your 2023 performance under what will be our 23 PCP reward plan. So that's my summary of my portion. I will turn it over to my colleague, Christy Howd, to actually walk you through the tool.
Thanks, Renee. I will share my screen and run through a few slides with you all. So I'm doing this via PowerPoint instead of our live dashboard. It is in production. And you will be getting your logins activated as we complete the guest account access, but I'm masking things so we're not sharing any one individual practice or any patient PHI so that you get the general flow of the application, but don't see any specific data you shouldn't. So first and foremost, the design of this dashboard, we wanted it to be a very intuitive, easy to use tool, something you can easily get to. It doesn't take too many logons and VPN connections and other things. So we spent a good amount of time working with our partners at the medical center in opening up the security access so that we could benefit from their protections on the network, but yet make it easy for you as individuals logging into the system. So first, to go into our system, go to the AHP website. And on our website, in the upper right-hand corner, there is a green call to action button for the provider engagement report login. This will always take you to a page with details around what's going on with the provider engagement report. If there is a maintenance, if there's a planned downtime, if there's an unexpected issue, we will put a message on this page rather than blasting you with emails and updates when it might not be something you're even going to attempt to log into that day. However, if you do bookmark the login and you run into a problem, we recommend you go back to this page first and foremost to see if there was something that's been identified. There's also a link to an email address to request support. If you need access to quick reference guides or release notes, there are links here as well. And this is just going to be our central site to providing you information around this, this dashboard. One of the things that's on a link document on that page is a quick reference guide. And it's 2 pages of just key points that I'm going to be demonstrating throughout this, this demo, but are not necessarily intuitive enough that you might remember it when you actually go to log in. Once you've used the system a few times, most of these things will just be second nature, and you may never need to refer back to this. I will be pointing out all of these sections as we go through. Page 2 of that FAQ or quick reference guide is about how to download, and this is the least intuitive functionality in the dashboard. And what this gives you the ability to do is to download any of the pages into a PDF document that you could print or share, or download patient lists into Excel that you can then work with offline. So this is something that we'll go over and I'll demonstrate as well. Additionally, on there is a guest account FAQ. So you'll have been in correspondence with Cherie Turpin and likely Renee and Jana about setting up your guest accounts. After we've gone through the initial suite of accounts for your practice, you may want to add somebody again in the future. You can refer back to this FAQ to find out the steps and the contacts of being able to get that set up for yourself. Additionally, we have release notes. And so major releases or major functionality changes, we're going to be announcing and including information in our network news. Other times we're going to be just, doing some minor changes or quick bug fixes. Those will be not announced necessarily in the network news, but all changes will be listed in our release notes. So if you've noticed a difference between when you logged in last and what you're seeing today, want to understand a little bit more what was behind it and when it happened, you could link to this document, release notes, and it's just an old example. The most recent version will always be at the top with the date that went into production, and then the component sections will describe what was the change that occurred in that section at that date. Moving on to logging in. So I've gone back to my page here around the provider engagement report. There is this gold button, View Provider Engagement Report, which is the link to the URL that takes you to a login. You can bookmark that if you want. Again, but just remember to go back to our website if you're having problems, and it directs you to who you should contact for support or if there's a known maintenance. When you click on that button or go to that favorited link, you will be taken to a prompt to log in. You are logging into the university's network. That's because we're hosting this dashboard on their network on a server that's dedicated to AHP. Your PHI is not accessible to everybody. It's controlled by the security that we're setting up based upon the preferences you're sending to us about your individuals and your practice. And so your username is going to be tied to the level of access you get in the provider engagement report. So you'll get a username, a password, and domain will be blank the very first time you log in. The drill down here is you are the university or the URMC Active Directory. And you want to go to the URMC Medical Center login. That is the systems that protect our PHI. Once you've done this the first time on any kind of browser, it'll remember it for you going forward. You click sign in, and then you're going to be prompted with Duo authentication. So part of your setup is to create your Duo account, identify your preferences, and then you can decide which way you want to confirm that you are who you say you are, and give that additional pass through that second confirmation before the login completes. So I've passed my login and my Duo authentication, and I am logged into the provider engagement report here. So it's a dashboard that's going to give you visibility at the highest level around how you're performing on your potential rewards. I'm a super user and admin, so I'm going in at the highest level. If you were logging in from as a provider or a practice manager, a quality person, your name will be here. Your practice name will also be here. Underneath the word provider, there is a version number of what version we're on. Right now, version 1.6 is in production. We're in the midst of testing and loading up some final data around version 1.8. So that will be pushed in the next few weeks. When you log in, your permission, your security is what's applied, and what you're seeing is the highest level of access you've been granted. And so I'm going in as a super user. It's telling me rewards are earned on a provider level. I'm not a provider, nor have I drilled down to a specific provider, so I'm not seeing anything here. Cost versus quality, that's shown at a practice level, and I haven't drilled down there yet. Nothing to show citizenship, depression, pharmacy, and LARC. And so we're going to navigate through this, and I'll show you how the filters work and how we drill in and what information is shown. I'm going to now, so when you first log in, the filtering should just apply and take you to your highest level of access. You may never need to expand and drill down into some other options unless you're a practice manager or somebody with a higher level in a more complicated organizational structure. But if you do want to drill in a little deeper, you would click these 3 bars here, and that opens up this filter section. If you click the X, it collapses and closes it again. So you don't need to continue to change the filtering on every page. I have blinded who I filtered down to. I filtered to a provider. So we can see what this specific provider would be seeing when he logged in. They're currently earning 44% of the possible 100% of the reward. And we'll drill in here in a moment. They're also performing $79.35 as an average PM for their practice location, and how their practice is doing on quality is 79% of points captured. The quality measure component is going to be pulling data out of Arcadia, and this is coming soon. We haven't finalized the data pull yet, as we're still, working through some of the quality performance issues we've seen after the V6 upgrade. This is not going to replace Arcadia functionality. It's just a one place to see how this provider is performing on the quality measures that they're being held accountable for. And then that's what is factored into that percentage on the provider reward. Citizenship, we'll drill into a little bit here. Renee already shared you can earn it at a practice level or at a provider level. This example is showing that it was not earned at the practice level. They didn't get 2 out of the 5 criteria, but this provider did earn it by doing 3 out of the 5 engagement criteria things. And we'll drill there a minute. Depression screening, this is showing how that provider is doing with their entire patient panel. How many are screened to date, and then based on last year's performance, what's the target this year? And so there's some different colors on this dashboard to call out where you want to pay attention to. Anything that's blue is that you haven't achieved the maximum amount to earning rewards in that section. So this is an example where we're not quite at target. And so it's a blue color rather than red and green. We chose blue and green. And then pharmacy, this component is being changed just slightly. So next time you see it, it will have a little bit different of an interface. As Renee pointed out, there are 4 drug classes. And right now this is showing how you compare against the overall rate of the AHP network on less costly medications prescribing. We want you to be at or above network average if possible, but we do have, if you're improving over last year's performance, the opportunity to earn a partial reward, and it's all based on which drug class. So every class will have a different amount of potential earnings for it. So we'll get into that a little bit more shortly when we look in that drill down as well. In pediatric LARC, this would be turned on for anybody that has is a family practice or a pediatric practice, and that LARC initiative this year will be earned based on participating in a training that'll be offered in 4th quarter. And next year, the criteria may evolve, and what you need to do and how you engage will be announced and driven by the initiative and where we're at with that, that component as we move forward. Now we have some blank space for other future initiatives, might be readmission, it might be the osteoarthritis or other things that we choose to add to the reward in the future. However, you'll always know what you're working towards and what's included. So we might start to show data around something in the future that wouldn't be truly part of the reward plan for 2023, but might be what we want you to start to see and say 2023 to earn towards 2024. So we will be having new components turning on and maybe turning some off, depending upon your engagement. So I want to look at the reward first. We're going to drill in here. And if I'm logged in as a provider, I'm only going to see my own reward. If I'm logging in as a practice manager, I'm going to be seeing everything, all the providers for that practice. And so this is just some dummy data. And I blinded out some of the practice groups and locations. But if it was just one provider, I'd see just one section here. I could, if I'm a health system with multiple locations, I'll be seeing multiple locations and then those providers within those locations. And in the bottom part here, we have all the components that are going to be part of your plan. And this is specific to you, your providers, and your practice. So if everybody's going to be participating in citizenship, everybody's going to be participating in quality. So they'll be adding a quality component line here. Same thing with depression screening. But pharmacy, we might notice, is on and off, depending upon whether there is prescribing opportunities for that particular provider. If there isn't, then that pharmacy, the percentage of the reward plan is actually goes into another area. LARC would be turned on for those who are participating in LARC. And so, as I mentioned, each component that you see will be dependent upon your engagement in the plan that we've created for you at the beginning of the year. So you'll also see here in the next column, what is that percentage that component could earn you? Citizenship will always be 10%. Depression screening can be anything, depending upon what is available in the other areas. Pharmacy, same thing, that percentage could change. LARC would turn on, that would take a percentage. So it's going to be important to know what the plan is for each provider. Then the next column is the reward that's been earned to date. And the data that we are calculating is near real time as we can get it for that particular component. So quality will be refreshed the first Monday of every month. Citizenship, we haven't set up the schedule quite yet, but would at least be monthly. Depression screening is refreshed every Monday. And pharmacy cost data, I believe, also is a weekly refresh. So you could see those rewards earning changing depending upon the last time the data was being refreshed. And then the final column is, where is the unearned potential? Where do you want to focus attention on, unearned rewards? And so you could export this out to Excel, and you could filter and work with this if you have a lot of providers you need to work with. You can also filter on just looking at one component. So if you were wondering how you're doing overall on depression screening, you would just turn depression screening on only, and that's the only one that you're seeing, and you could have an initiative focused. So I'm going to toggle out back to the home page. And I'm going to go into cost versus quality. You'll notice back over here, there isn't a component called cost versus quality. This isn't a portion of reward earning specifically. This is an area where we are starting to draw attention to the balance between lowering costs and improving quality. And so we can only do this at a practice location level because we're using Excelis data, cost data, and we can't get down to the level of detail we need for every provider. So it's informational, and it's to have a conversation around opportunities to improve and where we might want to focus your attention. So I'm going to drill in here and show you what we have to show. So bottom left-hand corner will always be a key as to where is this data coming from. The Excelis total cost of care report, actually, I did load up Q4. If you're looking in production, we'll see Q4 there. This was just a snapshot that we took a little bit earlier. We have not received 2022 cost data yet from Excelis. So we're looking for it weekly, and as soon as we get it, we will load it. And also, we are pulling quality snapshots. So as I mentioned, every first Monday of the month, we're pulling a new snapshot out of Arcadia, and we can see how your practice is doing and look at cost versus quality in this page. So at the top grid, there is the pharmacy PMPM. In the green line, we got to add a couple more keys on here just to clarify a little bit. But the green line is your practice and how your practice is comparing to other practices that are similar to yours. And by that, I mean the same specialty. So we're comparing pediatric practices to pediatric practices, family meds to family meds, internal meds to internal meds. So the black line is the average for similar practices. And what we want is to see you driving below average and talking about things that we can do with your practice to reduce the pharmacy PMPM. That's going to be focusing and looking into those RX, the pharmacy initiatives and the pharmacy drug classes. The medical PMPM could be other things. Again, same idea. It's the green line versus the black line, and we want to see the green line below the black whenever possible. And then the bottom chart here gives you a high level look at quality and cost and how your appearing on the scatter plot is your practice is a black diamond. If you hover over it, it gives you just the details around what's the average PMPM for your practice and exactly what's the percentage of quality earned. The grayed out circles are peer practices, and they are blinded. You can't tell who's who, but this shows us that this practice is performing in the silver quality block, and they're just slightly below the average PMPM total cost for Excelis. And our goal is to do have conversations and practice initiatives that are driving down costs, so we're going below the line and improving quality. So ideally, this light gray dot over here is doing the best they possibly could, in that they're earning gold quality, and their PMPM is below average and almost the lowest of all their peers. So again, it's a conversation starter and very important information to understand how we can maximize our gains that we get from the health plans, but then improving the quality so we can maximize our earnings as well and have more to distribute. Back to the homepage. Yeah, so we're going to skip over quality. We're going to drive into citizenship quickly. Citizenship is earned either at a practice level first. So if your practice does 2 out of 5 things, all providers at that practice have earned that 10% citizenship. If they didn't, and this is an example, then that provider could earn it on their own behaviors. And so when you drill in, this is an example of their only a practice manager attended at least 2 meetings, but they didn't do any of the other criteria here. And then this one, provider requirements, we've got to add Vatica in here, which will also be another category that you can earn your provider level citizenship. But this is an example, they earned 3 out of the possible 5. Back to the homepage and into depression screening. So this is a bit more complicated, and you can show how there's a lot more detail depending upon the initiative and how it is going to be presented to you. This is taking a look for that provider. Also, what we have up here in the upper right-hand corner is when was the data last refreshed. So this is an older screenshot because this is refreshed every week. And this is from a kind of a top-down view of that information that we have about how your practice is doing, or your provider specifically is doing on the depression screening and follow-up initiative. The top line is your patient panel as a whole. And the green is how many patients have been screened year to date, how many have not been screened but have not been into the practice on an annual checkup. So this is an opportunity. And then the teal color here, the top, is those that have not been screened but have been in for an annual checkup. And those may be missed opportunities, and we may want to drill in here and see, is there maybe a data issue that we're not getting information that you are doing screenings on patients? Or is this a workflow thing that we want to take a look at and see what we could do to possibly capture the depression screenings at the time of these well visits? The screened patient, so this is taking this green section here and then drilling in a little bit further and saying how many screened at risk in that 5 to 9 score category. And then if it was an more orangey color, it would be how many of those are positive screenings, which then we drill into and say, of those positives, how many have we documented follow-ups? On the right-hand side, we have a couple of things to point out as well. There's a section here to show a patient list. So the numbers are interesting and important, but what we really want to do is give you some patient lists that are actionable, that you can start to deep dive into. You can have follow-ups, and any of these sections that you click on, any of these colored areas of the bar chart will filter a patient list and give you the ability to download them to Excel. So I've blinded this one a little bit and just chosen, these are the people with no screenings and no checkups. So maybe we want to see, do they have an appointment for a visit, or are these patients that we want to reach out to and see if we can't get them in? On the chart that you can download to Excel, you'll get the patient's name, who is their PCP, when was the last screening done, and when is their next visit. And so again, this is telling us what the list is that's filtered. If I choose to look at the at risk, I could click on that and I could just, have the list of those that we should be watching and possibly calling and doing a follow-up screening on. I'll show you how to download when we get to pharmacy, but that patient list here is one that you can download out to Excel. A couple of things to show you about some hover help and what's important, and this is applicable on all of the other pages as well. If there are going to be target lines, and you can hover over any sections of the bar graphs or target lines and get pop-ups information. So this tells us our attributed patients baseline. We can add additional percentages and things here that are important to you. And additionally, we have these little eye icons, and that's for more information. And that's where we can provide more definitions around particular topics and terms, and provide you guidance potentially for other information. This is a pretty in-depth initiative and there's a lot to it. And so we've shared a lot of references directly with you, also through our website. But we want to make the dashboard a one-stop shopping. So you don't have to leave here to remind yourself what it is that this is about. So all of the components will have a link into reviewing the Depression Screening Initiative, or let me go back to show you where it is. So it's this review and a couple of drill down icons. So this, when I click on that, takes us to an information page, and it's specific to that initiative. Explanation about it, what's the program, who are your key contacts, links to toolkits or other resources that are important to it. These will open up another web browser page so you can stay in the dashboard, but also quickly jump to things that are important about the initiative. I'm going to toggle back and move on to pharmacy. So as I mentioned, this page here is going to undergo a little bit of a design change. We weren't quite ready to show it yet. But it's going to be breaking things down more on the drug class functionality. And so when we drill in here, this is where we're going to really see some details. And as Renee had mentioned, there are 4 drug classes for 2022. They may be the same in 2023, or they may be different. There may be more, there may be less. And so when we say you're eligible for 45% of the total reward on your performance in pharmacy, pharmacy is going to be divided by the number of drug classes that you prescribe in. So if you have a provider that only has opportunities and prescribes in 3 out of the 4 drug classes, we're doing the behind the scenes math to give you credit for the work that you do, and that's how you would earn your 45%. If one provider at your practice does long-acting insulin and another one doesn't, when you drill into their page, the one provider shows long-acting insulin, the other one doesn't. So it's very specific to your patient panel and the opportunities you have to switch to less costly medications. And also because pharmacy fills are, you may have already switched somebody or be in the process of switching somebody. So we're always sliding the window that we're looking at over a 4-month period of time. So we're only holding you accountable for the most recent pharmacy fills and calling out the patients that you may want to review and consider switching. The bottom section here is a list of all the patients that are being displayed from above. You can click in any one of the drug class lines above, and the patient list will be filtered on that specifically. You will be able to export this out, and you work that in Excel. And additionally, we know that not all prescriptions can be switched to the less costly for a number of reasons. If you review somebody and you made a determination that you cannot switch them, we don't want to keep holding you accountable to that. Pharmacy team will be available to do a patient review, and then they will flag that particular patient as reviewed and excluded. And then that will be removed from your target, and you won't be held accountable for switching that one. Maybe there's a clinical reason they can't get switched. That information about that, how you earn your reward, as well as how you contact pharmacy and all, will be in the details page when you drill in there. And I just wanted to show you a little bit about what a download looks like, because this is on the quick reference guide on our website, but also if you click the upper right hand download icon, you select crosstab, and that's the part that's not intuitive. It'd be better if it was the data choice, but it's not. For our Excel downloads, it's called crosstab. If you just wanted this page to download out to a PDF and to see all the colorful bar charts and everything, you would select PDF. But what I want to show you is how do you get that patient list to Excel? Because that's really what you're going to want. So you select Crosstab, and then you get a pop-up to download Crosstabs. And unfortunately, every page is comprised of many pieces. And each of those pieces has some data behind it. And most of that data isn't useful or actionable to you. What is useful and actionable is the patient list. So we've been unable to get it to the top of the list. We can't get it to sort there for everything. So what we've done, and I just dropped off. So what we've done was put an underscore in front of the naming convention. So it's always the last one in the list. So when you go in, you go to Crosstab, you scroll all the way to the right, and then you pick patient list, and then you can choose whether it's Excel or CSV, click download. It's very quick. It exports it out to Excel, and it's in the footer of your browser or in your downloads folder. And all that data that you saw in that section on that page and that patient list is what you get in Excel. And then I inserted a blank page, and that takes us back to our home page. And Pediatric LARC right now, this is just you've completed training or you've not completed training. When you drill in, it'll have some details around that initiative, when the training dates are available and all. Or if you've taken the training, the date that you took the training. And so that is the demo. Any questions? And it's 101. Very good.
Good job, Christy. Please feel free to throw your question in the chat, or unmute yourself and ask your question. Otherwise, you can reach out to myself or Jana Darlington in Provider Relations if you have questions, and we can help you with some answers. We will also be posting a recording of this session to YouTube, so it will be available to you to review at your convenience. Should there be something that was covered that you want to re-reference, and we'll.
Hi.
Is there a
Renee,
question?
this is Tanya at 12 Corners Pediatrics. How are you?
Hi, Tanya.
Hi. I know that there's no data to show in the quality tab right now, but do you have any kind of basic overview in terms of what that tab takes you? Is it just a hyperlink that takes you directly to Arcadia? Is there a way that this PER is going to show more of a snapshot of the gaps that is maybe more user-friendly than Arcadia itself? Is there any kind of description that can be given today about that tab where there is no information available?
Yeah, so we are unfortunately going to just show the total percent of points earned for the provider or for the level you've filtered into, and it will be a snapshot. So we're taking snapshots the first Monday of every month. So you will get more real-time data by going into Arcadia. As you feed EMR data, or we're loading claims and all, you may be seeing some different performance when you look in Arcadia. We're not going to show gap lists and do any patient-specific links here, because it is older data, potentially older data. We may do a bit of a drill down where, if you drill into the details, show you which measures and what percent of points at a measure level, but nothing deeper than that. My goal for next year is to enhance this just a little bit, but we have some issues between the version 5 data and the version 6 data and transitioning. But our intention was to be able to show you trending. So you could see how your last year's performance was compared to this year's performance on a measure by measure line, but we've got some matching issues right now, and I'm not sure that we're going to be able to do that between 2021 and 2022, but we may be able to do that going forward from 2022 on as we start to use the system in the future. Did that answer your question, Tanya? Great.
Anyone else? All right, well, we thank you for logging in today. For those of you that have your credentials and are able to log into the PER already, we hope that you will do so. We will make sure that when we're seeing those logins, we'll follow up to see what your experience was like and see if you need any assistance. We're still ironing out the accountabilities for that piece of it, but it's our intention definitely to follow up with folks that are logging in and using it, just to check in and see how we can help. Anything else from the AHP team before we cut this crew loose? All right. Thanks for attending, everyone, and enjoy the rest of your day.